Okay, Medstar, this is going to be long-winded and it's really coming, straight off my head, the top of my head. There's going to be a lot of pauses and a lot of shuffling of papers. So it's going to look kind of haphazard. But at this point, I'm tired of, having done everything the right way. I've sent you really good letters, which I have proofread and I have had all the facts supporting it. And I've also put a YouTube video where I wrote it out first and then I read it out and I supported it, and then I had extensive conversations with your agents. Now, all to no avail. Well, it's not all to no avail. What you did is you had a fiduciary duty to help me. Not only did you not meet your fiduciary duty to take care of my health, you spent considerable expense in harming me after the initial harm. So you kept on harming me. So now you're in a position where you have to meet your fiduciary duties, and which means you have to really go after yourselves because you harmed me. You have a fiduciary duty. Think of it this way. Okay, if you have a parent-child relationship and the parent harms the child, the parent still has the responsibility to take the child to the hospital with the injury. So it's not an issue of the parent harms the child and the parent lawyers up, right? You can't do that. Okay, you're going to get charged for the initial harm. So the parent harmed the child, you're going to get charged for that harm. And on top of that, it's still your fiduciary duty to take care of the person you are responsible for. So it's not a case where you can lawyer up at this point and hide, because you still have duties. So really, you have to go after yourself at this point, because you spend considerable expense in harming me. I want you to use those same resources and try to correct the situation. So I do have a primary care right now. So that primary care is going to have a lot of expense in having to put all these items in my record. But these items have to go in my record, and you should reimburse the primary care who I have right now for the work that he does, because he's going to have to take all these writings and all these letters and all these videos and everything, and he's going to have to put it in the records. Now, I tried to summarize things quick and get things to you, but then you just lied and cheated and committed crimes, and literally, Medstar, you are committing the crime of murder. Samet is a murderer. And I'm going to put that on YouTube. Samet is a murderer. So go ahead and see if you can rebut what I said, and I'll be glad to remove it off the video. So Samet and Medstar are murderers. See? So I know any doctor would go, or any healthcare entity would run out and get their lawyer to sue and get an injunction. But you have to disprove my statement. And I think I'm fairly accurate, Samet. You are a murderer. So I want Samet and Medstar to correct their problem. So now they're going to be claiming all kinds of rules where, no, this is not their job, that's not their job. No, it isn't. It's all your job. You had a fiduciary duty and you continue to harm me, and you have no burden. You spent considerable expense in harming me. So, there's no expense. So at this point, it's not going to be something where I'm going to spend my time and proofread things and this and that. You're simply burdening me. So I think I've done all I can to do it the right way, or to get the information to you. So now you just have to listen. And I don't know how long this recording is going to go. I'm going to try to just record it for 15 minutes at a pop, right? That's the limit on YouTube. And there may be 10 recordings, and there may be significant repetitions, but don't let those repetitions, don't think you can use those repetitions against me, saying that, this is the problem, he's just long-winded. No, it's long-winded now because I'm sick and tired. I'm literally sick because you almost killed me. Okay, so Medstar has almost completely murdered the patient. So Medstar has almost completely murdered the beneficiary to whom they had a fiduciary duty. So because of that, Medstar, it is going to be long-winded, and it is, it's coming right off my head. So, it's not like it's going to be, so it's going to be kind of disjointed. So don't run off and try to say this is like some kind of manifesto or he has a psychological problem. No. You go ahead and gather my evidence. I did everything I could. You continue to harm me, Medstar. So I want you to listen. You're going to be, now, there's no doubt, the primary care has to get everything into the records. And you have to compensate the primary care for that. But, so here's the situation. So you do know my patient history, and you have to get, which I know you already did, but you did it to harm me. There is a court case which I have. It's called, with my last name, and you know my last name, Samet, you jerk. And so Samet is a jerk, and I spent some time saying that, but till now I've been trying to do things. You see what I have put forth, so really, I think Samet has nearly killed the patient. So I think at this point I'm not going to waste my energy trying to be polite, Samet, you jerk. And so anyway, so go ahead and put this on the record. And so we know you're going to be responsible for the entire case which I submitted in federal court, which is my last name versus Innova Health System. So that entire item, it belongs to all the doctors that I went through your health insurance. Okay, it belongs to all of them. Now let me tell you what your job is. First of all, Medstar, okay? Now, you obviously, since I went through your physicians, you all have the fiduciary duty of a physician. Now, even if some harm occurred, and it did, you still have to continue to meet the fiduciary duties. You can't just lawyer up and start lying your asses off, okay? So, but here's the other problem for you, Medstar. You run. See, this is what happens. You, Samet, you pig. Because Samet, you pig. He wants to get. See, this is how a hospital executive gets richer and richer, and they always justify it, saying that, well, the other executives on Wall Street, well, they get this much compensation and so forth. Well, Samet, you can go ahead and try on Wall Street. Go try if you can have any position at Pfizer. You cannot. So you're a jerk who just, can only move forward in your healthcare, in your hospital executive position. So what a jerk like Samet does is, or any of the, I guess Samet is the current executive at Medstar, but any similar jerk in any similar health system, what they do is they get bigger and bigger and bigger and expand, so they can expand their income. So that's the only way they can grow their income, which is to get bigger and just kind of gobble up all the small players. Well, okay, so, and then they also sit down and they write, or they help write all the healthcare laws. So, and, they want to get money from the government. So what they do is they write the law so that Medstar gets money from the government. But in turn, now obviously there's no law that ever gets written saying Samet can continue to enrich his fat ass, right? Nobody ever said, Samet, you can continue to enrich your fat ass. Okay, so what they always say is, what Samet comes in and lies when he testifies or when he speaks to any kind of congressional representative, what he say, the stated goal is always for patient care or to take care of vulnerable patients. So whatever, it's a bunch of nonsense, right? But ultimately, no money was ever appropriated for a slob such as Samet, a jerk, to get himself rich. So anyway, and so it's going to be very important, Samet, so that you know that now what your Medstar did is, so as far as, now I know you work with like a full package deal with the government, so the way it used to be is you never got any, you actually lost money on Medicaid. So, but I think these days what I hear is the talk is that with the new healthcare law, that Medicaid, you also get some fairly good reimbursements. But still, even if that were not the case, it's a package deal. You get a tax break somewhere. You get a favorable local zoning ruling in your favor. So you get all that. So in exchange, you have this program called Medstar Family Choice, which you basically administer the Medicaid health insurance, okay? And with this health insurance, you have all kinds of responsibilities. It's not the usual health insurance, it says things like the doctors have to bring the patient into compliance. So if the patient doesn't report to the doctor for a medical exam, the doctor has to report it to Medstar Family Choice, and they have nurses and social workers who intervene. So we know this is really a second, this is a fiduciary relationship, kind of like a guardian-ward relationship. Is that, it's probably more of like a guardian-ward relationship, but it extends only to the patient's health. So as far as the patient's health, only for that issue, Medstar Family Choice, it's not like any other health insurance. So they have to, it's all, all that is in the rules. And they have rules that the patient has to get, I guess, like a complete physical every year, and the patient has, and then there is even on the medical report, it's actually asking for something. They use the term genitalia. I've never even heard that term genitalia actually used on a medical report, because they usually have some euphemism for it, but it's pretty outright. So the government says the patient's genitalia has to be checked, and the doctor has to report it. And there's all other kind of things about, well, is it domestic violence? Do you use a seatbelt? Very intrusive stuff. So they're really getting, and then they also tell the patient that the patient has to cooperate entirely with their physician, and it's not even, they don't even take, it doesn't even strike it in their mind that the physician can actually abuse or harm the patient. So right off, it's very much, it's said to the patient, you have to be truthful. So, in no other insurance will it say to us, an insured, you have to be truthful. Nobody uses that name truthful. That's a very condescending term. That's something you say to a 5-year-old. You say to a 5-year-old, you have to tell the truth. So, but at least it kind of points out what, at least it kind of points out what your responsibilities are. So basically, it's like taking care of a 5-year-old. You want the 5-year-old to tell you the truth. You want to check the 5-year-old's genitalia to make sure everything is okay. You want to ask the 5-year-old all kinds of intrusive questions. So you know what it is. So you have a fiduciary relationship. So that, and it's not just any fiduciary, it's like a guardian-ward relationship. So it's just like a parent-child relationship, but it's limited to healthcare. And there's no way you can get out of lying about this, Medstar. That's your relationship. So let me go ahead, now my time is coming up, let me go ahead and continue on to the next video, and you're going to keep being responsible for all of it.